My name is Jerad Gardner, and I am an assistant professor of pathology and dermatology at the University of Arkansas for Medical Sciences in Little Rock. I'm also the chair of the ASDP Social Media Subcommittee, as well as the chair of the ASDP Informatics Committee. I think I had some interest in skin when I was a resident. I'd been told dermpath was a good thing to go into, that it was a good job, it was interesting. And my early exposure to skin, I didn't find that I was very good at it, and I thought I'll never be able to do this. I didn't have a lot of dermpath exposure at our institution. And so I went and did a month with Ron Rapini at UT Houston, across the street from where I trained at Methodist Hospital. And it was just such an amazing experience working with him. And after that, I did multiple additional months with Victor Prieto and all the people at MD Anderson, and at Baylor with John Reed, and all of those guys working with these incredible personalities, these huge names in the field, and seeing such an amazing variety of cases. That was it. I just wanted to do this forever. So here I am. So when you ask questions about what will the future look like, it's always obviously very hard to say. And I think that when you look back historically at people who predict the future, the majority of them are wrong, very wrong. And there are a few who were very forward-sighted and were able to see what would happen. It reminds me of a story when I started medical school at Tulane in, I guess it was 2002. Our dean, he stood up at the white coat ceremony and he said, half of what we're going to teach you over the next 4 years is wrong. We just don't know which half that is, and so you'll have to wait until you're in practice down the road to figure it out. And I thought that was a very poignant statement, that we know that what we're doing is going to change. We just don't know which part of what we're doing is going to be different down the road, and which things are going to stay and remain. So it'll be interesting to see. You can interview me again in 40 years and we'll talk about it. I think actually my first meeting was 2007 in Baltimore, and I've been at every meeting since then. This is my eighth meeting, I believe. There's fantastic education, right? I mean, it's just morning till night, nonstop lectures and presentations, new science and dermpath. All of those things are wonderful. But I think what really stands out to me the most, and the reason that I come here rather than staying at home and reading a textbook, is the people. It's the relationships that I've been able to forge and build with other residents, with fellows, with the top leaders in the field of dermpath. Starting when I was just a second-year resident, it's getting to interact with those leaders, getting to have those people serve as my mentors, getting to meet other residents that then grow up and are now practicing dermpaths. And I think when you ask the senior people, that's what I see them. They value coming here and seeing the same people they've seen for the past 30 or 35 years and have made friends with and published with. And that's what makes it special. That's what makes it magic. So that's why I'm here. Well, the advice I usually give to the junior people is to get involved. And I think sometimes it's hard to know how to do that. And I tell them you need to meet everyone, you need to network, and it's more than just dropping your name. It's about building relationships. It's that kind of building the right relationship can make an enormous impact on your career, on your entire life. I mean, think about getting married, right? You find that right person, it changes your whole life. And it's kind of the same way with finding a mentor. I spent a year with Dr. Weiss as my soft tissue mentor, and a year with Doug Parker as my dermatopathology fellowship mentor. And the time you spend with those people, it really changes the scope of the way you think about things, your basic understanding and approach to being a doctor, to being a dermatopathologist. It changes your whole career. So I tell the junior people, find those leaders and those mentors and gravitate to them and build friendships and relationships with them. And that's what's going to change things for you. That's what the people, the relationships, that's really what makes things special. And so I really tell the junior people to do that. And obviously, I also tell them to use social media a lot, because I think there's a good bit of value in that as well. I started doing social media, 2007 or 2008 with Facebook. I was, with my friends and family. I started adding other doctors after I go to meetings, residents mainly, and then faculty eventually. And it was a great way to keep in touch with people and to kind of build friendships in between meetings and keep up with all the names and faces of the people you meet. And then a couple of years ago, I guess it was 2013, a couple things happened. I gave a couple of lectures at the CAP and the US CAP meetings about how to use social media as a pathologist. And they were just sold out, packed crowd. Everyone wanted to hear about this. And since then, I've given maybe 10 or so lectures, invited lectures, and people constantly want to learn about this. And I started a dermatopathology group and a bone and soft tissue pathology group on Facebook in 2013 as well. And those are both at over 17,000 members. as of today. So I was just blown away by how many people joined and were interested in sharing cases and discussing. And so it's that really made me realize this is a robust tool. Like there's a great amount of power here in bringing people together to discuss about things that are important. And in getting messages out there. When you have access to that large of a group of people, you want to share a new article, you want to share an idea, you want to share a case and say, hey, I want to write this up. Does anyone else have something like this? It can reach so far. I mean, it's amazing. So for an example, in my dermatopathology group, Keisuke Goto, who's a pathologist from Japan, he posted this really beautiful case of cutaneous sparganosis. It's a worm that infects your skin. And I said, we should write that up. And so I partnered him with Gina Johnson, who is a resident that I was friends with at Emory University. And we, together, the three of us wrote this up, and it was a cover piece for the Journal of Cutaneous Pathology in 2015. But it was spawned because of Facebook. Facebook is what made that article happen. And we, from Japan to Atlanta, Georgia to Little Rock, Arkansas, we partnered together to write this up. I would have never even met Keisuke if it wasn't for Facebook, let alone publish with him. And so to me, those kind of things demonstrate that there's an enormous amount of power, enormous amount of synergy that can be accomplished here for research, education, everything. And those kind of things really changed my views on it.